Hey folks, AshevilleThingsIndustry.com. Just hanging out in the resident office. Dr. Queso, he's just showing me a couple tips, tricks about, of all things, wedges, and using them, place them interproximally. So he's got some really neat things. Go ahead, man.
Okay. So pretty much the first thing is different types of wedges. There's hundreds of types out there, just the few types that we have here and that we're familiar with. We've got, I believe they call these just the wizard wedge. Someone said that it possibly looks just like a wizard's hat. Who knows? Basically just a big triangle. You look at it from the end view. See if we can hold it up here and make it look good for the camera. Just looks like just a triangle, really. There's no real curvature to it. It's just a slice taken out of a piece of wood. These other wedges called anatomical. From the end, looks like a square. But if you look at it from the top view, it's got a little bit more of a slope versus just a sharp angle to it, as well as from the front. It's got a nice curvature, more curve similar to what a natural tooth has to it. Many times you're in the middle of prepping a tooth. Drew it out here, we'll just draw it again real quick. You got your tooth coming up, you got your box and your interproximal portion, you have your adjacent tooth coming up, and so we want to create a nice curved contact area so we get a nice area, a contact area versus a contact point. Well, if you use one of the wizard wedges, sometimes they become misguided and you've got your triangle, and that can become forced into the area, which would actually cause a break or a step in your restoration, or it can cause you to not even have a restoration fully. So with this anatomical wedge, because it has a square base, it's more likely to stay in the middle as well as create that contact form and that embrasure towards the gingival that you're looking for.
Now you've got a couple tips you're showing me about how to modify them to help getting a proper contour.
Definitely. One thing, if you've got a pretty deep box and you get your gingiva papilla in the way, what you do is you actually just cut off the part that goes interproximally that gives you still the separation between the teeth, but doesn't interfere with that interproximal contour area. So this will work with the wizard wedge, but I like these anatomicals a little better, so I'll show it on that. So what you do is, I like a 12 blade. You just take that and you shave it down from the occlusal aspect, so you still have the width that will press the two teeth apart, but you won't have the part that extends towards the occlusal, which will interfere with that contact. So what started out, you can take as much or as little as you want. Obviously if you take too much, it'll create it so it's very fragile and it might break off interproximally. So that's one way to help with that box form there. The other way is if you got a pretty wide buccal lingually, is you can actually shave it on the other aspect and create the curvature from the buccal to the lingual. So it forms a concavity versus a straight line, which will hug and adjust to the tooth a little bit more naturally. This might be a little too tight of a space, but it's typing on so it doesn't care. But it just sinks right in there, separates the teeth, and it's not separating more on one side versus the other. The last trick is to help with that separation is you can take wedges after you've pre-adjusted them, or even before if you don't want to, and you can soak them in a little bit of water. It makes it like a sponge if you're using the wooden wedges. Now we've got a couple in here that we've soaked already. We just take it and set it in there a few minutes, 1 or 2 minutes at the most, and it kind of soaks it up and it expands it a little bit, makes placing the wedge a little bit easier, as well as it keeps it in place once it's in there. And that's pretty much it.
Now you said, just to go over, so you're contouring the wedge buccolingually and actually occlusal gingivaly. When does it feel like you need to? How do you know? Like, do you know before, or is it just a feel thing?
Sometimes you can tell before, especially on pretty extensive restorations. using a contoured wedge seems to help better. If you have opened up pretty wide as far as the contact interproximally, getting a wedge on one side, you're going to have the other side completely open. You get those larger interproximal restorations. So contouring it will leave it a little bit more minimally in the right center in the interproximal, but you still have more wedge to help adapt the matrix to your sides.
So like use a bigger one than I'd normally use, like the little one, and try to cram it in there. Use a bigger one, contour.
Use a bigger one and contour it so it'll leave it a little bit more bulbous, I guess you could say.
Yeah.
On your, so like this one right here doesn't really fit very well right now.
Yeah.
But if we take it and contour it a little bit, it will fit interproximally. It'll take a little bit of effort to get through interproximally, but it'll still have more material on the palatal surface, which would adapt a matrix band a little bit better, as well as over on the buccal surface, it has more wedge material that will help keep that gingival portion of your matrix adapted. The buccal and lingual portions of the matrix, that's a little bit more accessible, so you can adjust that with a burr or with a 12 blade. But that gingival portion, it's really hard, and that's where most people end up with an overhang or with a short filling. So you definitely don't want that.
Okay, so the last question I have there for you. Now you're talking about contouring one side. Do you contour both sides? I mean, both.
For both sides in that interproximal?
Yeah.
I generally don't contour both, because as you can see on this one, it's got a nice curvature. In this case would be towards our mesial. If I were to do the same thing on this side, it would create almost like an hourglass figure, and leaving the wedge very prone to fracture. I've actually broken a couple off interproximally and had to go digging after them. Never had to leave one behind, but it's no fun to break one off and then try to figure out where it is. So also I feel like it doesn't give me as good a separation as I need. If I have restorations that are back to back and I end up needing that, I normally just contour a second matrix and make it work at that point, because you still need to have the strength of the wedge to be able to cause that separation without fracturing.
Cool. All right, thanks a lot, man. Cheers.